Okay, I think we should start, Doctor.
Okay, inshallah. Okay, so Bismillahirrahmanirrahim. So I think today is the my first session of ECE. So as we all know that ECE stands for Early Clinical Exposure. So the session which I shall be covering is a very brief session because in details you will be having your skill lab on this. So today the session which I shall be discussing is learning with simulated patients. So any idea? I think most of you must be familiar with this term simulation. So anyone? Right? Yes, Rami, what is simulated patient? Any idea? Like we do simulations in various activities in our life. Like suppose if I go to a driving school, then in some driving schools, there are some simulators which help you and they assist you in the driving process. You may have a just a dummy car or any other equipment which will help you how to learn the various, uh, I mean, how to be more familiar with the driving. So similarly, in the medical science, we have simulated patients. So it comes from the name simulation. Okay, so I will just discuss in more detail about it, then you will understand. Because as you can imagine very well that right now, like suppose all of you are in year 2. So what will happen if we expose you directly with the real patients? Will it be possible for you to directly deal with the patients? I don't think so. Yeah, I don't think so because it will not ethically valid also and not be good for you as students if you are directly exposed to the real life patients. So what we do, we first expose you to the simulated patients. So and these patients are the, as you can say, these are just like a volunteer and they will show all the features and they will tell you everything which which will be informed. All the information of the real life patients will be conveyed to you by these healthy volunteers. So basically, these are the volunteers who are informing us and who are helping us in our learning process. I will come to it in more detail. So the patient is the center of the medical universe around which all our works revolve and towards which all our efforts trend. Because why we are in the medical field? Our main aim to join this medical field and to work in the medical sciences is to provide proper health care to our patients and to the community. So basically, we have to deal with the patients in our medical practice. So as you all know that for dealing with the patients and to help us how to communicate with the patients, we follow the Calgary Cambridge framework. So I think you already had 1 or 2 sessions on this Calgary Cambridge, and all of you must be familiar with the 5 basic steps which we are following in the Calgary Cambridge framework. Can anyone tell what is this? What do you mean by Calgary? Is it the name of some scientist or what is it? Why we are following the Calgary Cambridge? Any idea?
I think it's system we follow in relationship with the patient, right?
Yeah, so basically Calgary is a place in Alberta, Canada, and Cambridge, as you know, is a place in UK. So there were 2 scientists whose name were Kurtz and Silverman. So these 2 scientists they worked together and they made a medical interview communication model. So basically, this Calgary Cambridge framework is a medical interview model which helps us in communication with the patients. So it is a quite a good model, especially for the medical students and in every communication, like a patient comes to you in a OPD. So how you will start the communication process. So we should always try to follow these 5 basic components of the Calgary Cambridge framework, starting from initiation of the session, because initiation of the session is the first and the most important session. That is how we start dealing with the patients. Like for example, if a patient comes to you, then how we will initiate the session? We will first greet the patient. We will first welcome the patient. You will greet the patient. You will ask his name. Then you will introduce yourself. You will tell the patient about the role and the nature of the interview. You will also take the consent before uh, doing the interview process, and you will also tell and uh, make the patient comfortable. He should be made aware of his confidentiality, that you will inform him that all the communication will be confidential, and then you will further go ahead with the consultation. So this is how we initiate the session, by greeting, by making the patient comfortable, by developing a proper rapport with the patient. The second step comes of collection of the information, how we will collect the information, which is called as gathering of the information. And this gathering of the information is the main step in which the clinician comes to know that why the patient has come to the clinician. So what you will do, you will first start with the open and closed questions. I think you know what is the difference between an open-ended question and a closed-ended question. In the open-ended question, you simply ask the patient to tell his story, that why he has come to you. So, and the patient will keep on explaining to you in his own words, in detail. You will not try to interrupt the patient, but you will try to listen to all the complaints for which the patient has come to the doctor. Then, in the meanwhile, you will also keep on switching from the open questions to the closed questions like yes and no. You will keep on asking the relevant points. I'm not going in detail because I think this part has already been covered in the previous sessions. So in the gathering of information, you will try to obtain the clear sequence of the events. You will try to get all the relevant information, and we will try to collect as much as possible the information from the patient. Then the next step is the physical examination part. You will do the examination about the problem for which the patient has come. Then we will do the also we will ask about the patient's perspective. You will try to explore the patient's perspective, and patient's perspective means the ICE, ICE. I stands for patient's ideas. What are the patient's ideas, his beliefs about his problem? Then you will also inquire about the patient's concerns, the main concern for which he has come to the clinic or the hospital, and what does the patient expects, the patient's expectation. So this is called as the ICE phenomena. I for ideas, C for concerns, and E for expectations. What the patient expects from the doctor. So we will try to explore the patient's perspective. Then, uh, as a clinician, you will try to explain the sequence of events to the patient. You will explain the planning, what planning you have planned for. So all this we will do, and the last step will be the closure of the session, in which you will summarize the main points of the interview, just to make sure that any point is not missed by the patient. And ultimately, you will thank the patient and tell him that what next he is supposed to do when he has to come for follow-up, or he needs to do some referral. So whatever advice you want to give to the patient, you will do in the closing part, in the closing decision part. So these steps are universally followed worldwide. So therefore, it is a very well-known accepted model, which is called as the Calgary-Cambridge framework. And it helps us in building the relationship between the doctor and the patient. So doctor-patient relationship can be built very well if we follow all these 5 basic steps of the Calgary-Cambridge framework. So being a medical student, it necessitates that the patient's presence in all stages of your study. So it is very important because ultimately in our life, we are going to become the medical consultants, and we will be dealing with the patients. So as a medical student also, it is very important that you come in contact with the patients in all stages of your study. However, what is important is that dealing with a real life patient or a real patient may seem unsafe or unpractical in the early stages. So as I told you that right now you are in the year 2. So it's too early for you to be exposed directly with the real life patients. So I know that you will be exposed to the patients, I think maybe from year 5 and year 6, and then later on in your internship. Then obviously you will be going to the hospitals, you will be going to the primary health centers, clinics, and you will be exposed. So before that, before real life encounter with the patients, you need to be well trained. You need to be well trained with the simulators or with the simulated patients, so that you know how to deal. You are safe. You are also safe, and the patients you are dealing with, they are also safe. So it is for the safety concern. It is also quite unpractical if we directly expose you to the real life patients now at this stage. So to overcome this obstacle, what we do, we are doing the patient simulation. Now you will ask, what is the exact meaning of patient simulation? So as a fireman is trained in a real life situation, training can be unsafe. So can we directly expose a fireman to go to a building which has caught fire? No, it will be unsafe for the trainer. Also, it will affect the performance of other firemen, because in a real life situation, a trainee has no chance to be supervised. We can't supervise a person in a real life condition or situation. There is no time to give feedback. And obviously, there are no chances to repeat the act. You can't practice, because if you are directly exposed to a real life condition, there is no time for any feedback or any repetition or any practice, and nobody will be supervising. So this is the drawback if a person is directly exposed to a real life situation or scenario. So what are the simulated patients? So these are the individuals who are trained. By individual, I mean the healthy volunteers. These are not the patients. These are the healthy volunteers. So these are the individuals who are trained to perform the role of a patient realistically and consistently. These simulated patients, they are trained in such a way that always uh, whatever they are being asked by the students or by the interviewers, they will answer the same things to each and everyone without any bias. So, and they will play the role in terms of their expression, in terms of their understanding, in terms of anything, everything. They will always behave as if they are the real life patient. So they will play the role of a patient realistically and consistently. I think you will also be practicing the role plays in your skill lab. Then I think in the coming up skill lab, you yourself will be playing the role of simulated patients. So they will always play and perform as real life patients realistically and consistently every time. Because when you will be having your OSCE, maybe in the clinical departments, then you will be exposed to the simulated patients. And when you will ask and inquire anything from these simulated patients, they will keep on performing as real life patients, and it will be consistent. Why do you learn with simulated patients? So why do we want you to learn with the simulated patients? So there are many reasons for this. As I told you before, it is the most important, it is risk free. There is no risk of harming the patient. Like suppose if you are exposed directly with the patient, then there is a risk you may harm the patient. Or suppose if the patient is suffering from any infection or any communicable disease, then the doctor is also at risk for contracting the disease or infection. So it is a risk-free approach both for the patient or the simulator as well as to the doctor or the student. It is quite fair because the performance is consistent. There is no bias. Whatever the simulators will answer to one student, the same information he will convey to the other student. So there is no chance of any bias, and it is totally fair. It is consistent. The information is always fixed. It is consistent. It will not change. Like suppose there are 10 points which are supposed to be informed by the simulator to the patient. So always and every time once you will interview, they will tell the same 10 points. So it is quite consistent. It will not change. Then it allows a good time management because there is no time to waste. The simulators are well informed, they are well trained, and they give the required information in the designated time frame. So it will allow a good time management, especially in the exams, in the like OSCE. It allows to get a focused feedback. So because the information is quite consistent, they are behaving as the real life patients. So it will help you in giving a good feedback on the encounter, on the communication. And the simulators are very helpful and very beneficial for allowing you to practice the communication and clinical skills. So every time you can keep on practicing on the simulators, and it will always help you to improve your communication and the clinical skills. So therefore, it is very much beneficial to work with the simulated patients. It is just as a practicing tool, and it will help you if you practice good with the simulators. Then later on, when you encounter with the real life patients, it will be very much beneficial for your clinical expertise and for developing your clinical skills. So questioning, like I mentioned in the initiation of the session, so it is an essential skill which you need to apply for gathering information. How we will gather the information? So as I informed before, there are two types of questions: open-ended questions and closed-ended questions. As the name is open, it means that you are giving free time or free space to the patients or the simulators to open up with their problems. So it demands the open questions, it demands a descriptive reply. And like, for example, what is the most difficult, worrying, depressing? Tell me. So you will just ask the patient to explain everything about his problem, about his complaint. So it will take more time. It creates more work. Sometimes it can be stressful for the doctor because the patient may take uh, around 5 to 10 minutes to explain all the problems. But it helps to understand the patient's problems because it right now in the initial in the gathering of information part, you should not jump directly to the closed-ended questions. Always start with the open-ended questions so that the patient feels comfortable. The patient is assured that yes, he has communicated all his problems to the doctor. So we understand that yes, it is time taking, but it helps in developing a good rapport with the doctor, and all the information is conveyed to the clinician because the patient is speaking directly to the doctor and without any break and without any pause, and he's trying to speak up everything about his complaint. On the other hand, the close-ended questions, in the close-ended questions, the answer is simply yes or no. For example, if you ask the patient that do you feel stressed these days, so he will simply reply yes or no. So it will not give you much information. So it will leave many problems unexplored and the patient's anxieties will be unresolved. So always we should start with the open type of questions because by that, by asking the open questions, the patient will keep on elaborating his story and he will explain everything to you. But yes, we will keep on switching from the open questions to the close-ended questions so that your communication is not very long. Because always we should try to ensure proper time management also in our communication. This is the part of the gathering of information, how we will do it. Yeah, so I think it was just a small session about the simulated patients. And the main thing which we should understand is that what is the benefit of studying with the simulated patients? So that I think you must have understood because in the ECE sessions, our main aim is to be trained for the next sessions, maybe in the year 5 or year 6, when we will be directly exposed to the real life patients. So if you are well trained at this stage, then I don't think there will be any problem once you are communicating with the patients in the real sense. Okay, so I think this is all about this session. If there is anything which you need more, please, you are most welcome to ask anything. Yeah, any questions?
No, thank you, Doctor.
Thank you, Doctor.
Okay, thank you so much. Jazakallah khair. God bless you.